liposuction part. And Sarah's wide awake. We've already tumesced out the thigh. You can see that with the vibration, it helps quite a bit as far as, now you can turn the suction on.
Oh yeah.
It helps quite a bit with
the
pain tolerance.
I am, yeah.
So we're going to go ahead and put the cannula in, and the machine really does all the work. You just kind of guide it, put it where it wants, and you can see the fat coming out of the tube. And really there's not a lot of work on my part. I just kind of put the cannula where I want it. It glides through the tissues nice and easy. So it's not like what you see on TV where there's a lot of jabbing and people always come in worry about the jabbing motion and stuff. So Sarah, can you tell us what it feels like?
Just vibration.
Yeah. So it's not a really painful procedure. It's gentler, the recovery is quicker, and patients do well with it. They really, get back to work quicker and just don't have as much downtime. The other thing I've noticed with it is for redo lipos, it goes through the tissues, glides very nice. So somebody who's had lipo before, then going through the previous scar tissue seems to go through very nice. So right now we're just kind of gently taking out. We've already aspirated about 100 cc's of fat.
Does it seem to come out faster?
I think it comes out about the same, but I think the fat is a different quality.
Yeah.
If you look at the quality of the fat, it looks like pure fat.
Right.
Don't see as much tumescence in it. And I think that's, obviously one of the advantages is for fat grafting, that the Tickle Lipo is good for fat grafting. But it's a different technique. It's not the stabbing and jabbing motion we do with traditional liposuction.
Not as aggressive, but you're getting as much out.
Well, because the cannula in the machine itself is fairly aggressive, and you gotta take that consideration. So you're gonna just change angles here and come a different angle. It's real important with liposuction to do a lot of crisscross, and this way you don't go through the same place. So, if anything was ever truly lunchtime type procedure, this can definitely be considered it. You should definitely take a day or two off from work. You have to wear compression. Nothing's totally painless, but this is about as close as I've seen for surgery. She feels pressure?
It's a little uncomfortable there.
A little there? You can always put a little more tumescence too.
So it's like a lower.
Yeah, it feels like you have an ultrasound treatment.
Oh. You hear that?
Feels like an
just
ultrasound treatment. Yeah. Well, it's kind of like, the vasers. The difference with the vaser, it's ultrasonic and it generates a lot more heat.
Right.
And that's more painful than this, because I have patients all the time when they use the vaser.
You couldn't do that like
No,
this.
because it's just more uncomfortable for them. So far we've already up to almost 300 to 400 cc's of fat. I don't know if you want to zoom into that
suction
canister over there and take a look.
This way.
About 400 cc's.
So do you hear anything in your ears at all? Like vibration? The vaser, they hear that. They're not sick.
In fact, you can see the quality of the fat is nice pure fat, which is ideal for fat transfers to the buttocks and breast and other areas. We wanted it, but we're saying another day. So you can see just from the technique, it's probably not what you're used to seeing on TV shows. Again, just crisscrossing is super important with liposuction in general, just standard technique.
It is actually.
I have to make another hole there.
Take one more. Good. Well, the needle part is, anyway. Ow.
just gonna push this pillow up a little higher.
It's all good? Okay.
The other important thing with liposuction of the outer thigh, you want to make sure the thigh is in a totally straight position, because if you don't, then you can dig yourself a hole and create a nice divot. So that's why we use a special pillow to keep the thigh elevated. Hmm?
Like going to the dentist?
Going to the dentist?
Like not all that noise.
Yeah. But it's not painful, right?
No, no, polish your teeth. What polish your teeth? Get it clean.
Like if you get your teeth cleaned, right?
Right, like they're brushing your teeth.
Yeah.
Oh, okay.
Yeah, they use that vibratory
I don't
toothbrush
know.
on your
I know.
teeth.
What dentist do you guys go to?
Well, we're getting a lot of fat here. We're going to be up to 600 here. And
That's uncomfortable, sir?
we're getting down on the lower part of the thigh, so maybe a little more.
Ooh. Just a mystery. Whatever you want.
Yeah, and if you have a little area, a little hot spot, then you just put a little tumescence there. Try to do it with this.
Hot pepper.
She seems like, Holly, can you step on that? Just that one foot pedal, just want to put a little tumescence. Just put a little more fluid, numbing solution in the lower part, which sometimes doesn't get as much. That's good. And that'll help out that area a lot. Okay. Yeah, I've used a lot of different vibratory cannulas, and of all the ones, this is the one I like the best. I've used the Air one, I forget the name of it, and then I've used other vibratory reciprocating type cannulas, but this one seems to be the nicest one.
V-Pal?
V-Pal, that was the other one we have, yeah. So, we're just about done here, finishing this area. We're going to be well over 600, which is a pretty nice amount for just an outer thigh. And you know, the whole goal with this is to keep it nice and smooth, so I think we're going to pretty much stop with the outer thigh here. It's nice and smooth. We've got a good 600. And I think we're pretty much done. We'll put her in a girdle after we finish the other side and give her the day off, and she'll be back in the saddle tomorrow working. So.